Hello, and welcome to our lecture on joints. What is a joint? It's not what Bob Marley sings about. So, what do you guys think joints are? Well, they're where bones come together. Oops, how did the Friends theme? It's come together, not come to meet. So, are just joints where bones come to meet? Or could it be right here? Is that a joint where bone and cartilage meets? So, are all joints movable? Well, if I just accuse this of being a joint, the answer would be no, but was that a joint? And what are some examples? The shoulder, the elbow, the knee, the hip. Those are all joints. I taught you some joints too already. Do you remember what those are? Sutures are joints too. And if you remember, sutures are non-movable joints, so not all joints are able to move. So, what is a joint? What did we just say? Where bones come together, or cartilage. I wonder if there's something else in there. Do all joints move? No. What are some examples? Elbow, shoulder. So, we are going to explain functional, that is what they do, versus structural, what makes that parts of the joint. So you'll be able to explain the two types of joints. And unfortunately, there's not 100% overlap between the two. You will be able to give me the subclassifications of them. And on the test, this is going to be, I will give you the definition, you tell me which type of joint it is. And you'll be able to explain the parts of the synovial joint and give their function. So, articulations. That is the scientific way to say joint. An articulation, yes, I stole this from the book, is a fancy word for the joint. It is where bone makes contact with bone, got that one, cartilage, or teeth. Your teeth in the alveolar process is a joint, and they're said to articulate together. Now, the range of mobility varies. So your skull has these sutures. Hopefully, the sutures came together and they are immovable. Your intervertebral disc, if we are in the face-to-face class, you would see me doing the palm tree pose in yoga, which you go that way, then you go that way. Your intervertebral discs are slightly movable joints, and they're still fairly stable. Then you have your shoulder joint. You put your left arm in, you put your left arm out, and then you shake it all about. That's not a very stable joint. It has 7 trillion muscles and 5 trillion ligaments that help keep it in place. So, I will ask you this. Range of motion, immobile is stable, very mobile is not stable. Oh, there's our little picture. So sutures, those are immovable joints. Remember the coronal suture, squamosal suture, lambdoid suture. They are very, very stable. They're not going to move at all. A symphysis joint. Remember your two pubic bones come together like that? This joint is a symphysis joint. It moves during childbirth. So, but it's still a fairly stable joint. Doesn't move that much. Your elbow joint. It is uniaxial. It goes from a 180-degree plane to a 90-degree plane where it flexes. That's still a fairly stable joint. Your hip joint. On social media this last week while I'm recording this, a picture of a gymnast just putting her hip joint out of place. Watch gymnasts. They have humongously mobile joints that they dislocate all the time, apparently. Then we have our shoulder joint. Look at all those ligaments holding it in place. Then you have a ton of muscles as well. Don't worry, it's not 5 trillion, it's only 4 trillion. So, synovial joints range in motion, and the more mobile they are, the less stable they are. Do you get the hint that I will test you on this? Good. So, we're going to talk about joint classification. They are classified 2 ways. Structure. What connective tissue is involved? So sutures. Dense, regular connective tissue is involved. We have our symphysis joints and our intervertebral discs. And we actually have our coastal joints right there. That's cartilage. And then we have joint capsules around our synovial joints. Function, what their degrees of mobility is. Now, there's not 100% overlap. It's the cartilaginous joints that cheat. So, the joint classifications, we have fibrous. Bones are held together by dense, regular connective tissue. So in our suture, they're being held together by dense, regular connective tissue. In our forearms and our legs, remember I kept telling you there's an interosseous border on the bones? Well, there's dense, regular connective tissue in there. And actually, in your teeth, there's dense, regular connective tissue in there as well. Cartilaginous, bones are held together, or it's held together by cartilage. So we have our pubic symphysis, which is fibrocartilage, our intervertebral disc, which is fibrocartilage. Then we have our costal cartilage, forming joints on either end, and that's hyaline cartilage. Then synovial, you have a full joint capsule, synovial fluid. We'll spend most of our time talking about these. So I will ask you the definition of these. The computer will roll a 3-sided dice, 33% chance of that one, 33% chance of that one, 33% chance of that one. Then there is functional. Now, there's not a full 100% overlap between functional and structural, unfortunately. A syn means together. Arthrosis, I think arthritis is problems with your joints, so it means together joint. No, or same joint, movement. That would be your skull bones right here. There should not be movement in your squamosal suture and your sagittal suture. In your teeth, here's your alveolar process. Your teeth should not be falling out. Don't watch hockey games. That's where all the teeth fall out because they're getting hit in the face. So you should not have movement there. Now, remember what this is? This is the mammary. You have a joint between the cartilage and the mammary. That is immovable. It's not moving. So, a synarthrosis is a fully immovable joint. Amphiarthrosis. So these both end in arthrosis. What's amphi? Amphibian. That means both. So amphi could do both. It has a little movement. Your pubic symphysis. When you give birth, this ilium is going to be pulled that way. That ilium is pulled that way. It's actually going to make this opening even bigger. So the child's head, there's the child, can go through. That is an amphiarthrosis. When I do this in lecture, I do the palm tree pose. That is, you basically bend your back like that, then bend your back like that. I guess downward facing dog and up dog, you're doing back bends too. So that is a slightly movable joint. Arthrosis. It's freely movable. So your elbow joint, here's your humerus, here's your ulna, right there. That is a fully movable joint. So again, 3-sided dice will be rolled by the computer. 33% chance I'll ask you what a synarthrosis is. 33% amphi, 33% di. Now the good news is your follow-up is going to be matching questions from the lab book. So, our fibrous joints. Remember, those are held together by dense, regular connective tissue. You need to know the 3 subtypes. Again, you will roll the dice which one I'm going to ask. A suture is anywhere 2 skull bones are held together. So my favorite suture is right there. That is the zygomatic temporal suture. We don't have to worry about that one though. We learned about the coronal suture, the squamosal suture, lambdoid suture. They're being held together by dense, regular connective tissue. Now, all fibrous joints are immovable or only a little bit of mobility. So, this thing right here, you have a ligament connecting the tibia to the fibula. To find out, this is actually an amphiarthrosis. So the fibula has some give to the tibia. And we actually have another one in between there. That's our interosseous membrane. This is a syndesmosis. This is joints held together by a ligament or fibrous tissue where you have a little bit of movement, a little bit of give. So this can move. This can't. Now, your teeth. Here is your alveolar process. And here is your tooth being held in place by something called cementum. Not on this test. That's on our last test. That should be immovable. It better be immovable. Your teeth better not be falling out. So fibrous joints can be movable or immovable. That is our bad boy. There's no joint cavity, and it's held together by dense, regular connective tissue. So, our gomphosis. Students don't like this one on the test. This is the tooth. We have our cementum holding the tooth in place. So the tooth better be staying in its socket. Here's our alveolar processes. Immovable joint between teeth and either the maxilla or the mandible. A suture is our immovable bone joints between skull bones. I'm very happy they're showing the coronal suture right there. Usually they show the sagittal. Then we have our syndesmosis. I'm going to spend a lot of time talking about this joint up here today. I spent a lot of time in last class too. We have this interosseous membrane. That's a syndesmosis. That is forming between the two bones. And again, you could feel your radius rotating around the ulna. This is the radius. This is the ulna. This is slightly movable. So watch out that we have our suture. That starts with an S. A syndesmosis starts with an S. And these, we have symphyses that start with S's. So you have a lot of SY joints. The cartilaginous joints comes in two flavors. The bones are attached by cartilage. There's no joint cavity. And there is a synchondrosis and a symphysis. Oh no, more sins. It's a sin to confuse all these sins. So what I would actually do is write out all of these words, synchondrosis, symphysis, syndesmosis, and write their definition out. It is very easy to confuse them. I do not need to confuse you with the test. These names are confusing enough. A synchondrosis, this is hyaline cartilage, and we find it where the ribs attach to the costal cartilage, the mammary or the body of the sternum attached to the costal cartilage, and remember our growth plate? That's a huge zone of resting cartilage. That is technically a synchondrosis. My mind was blown away when I learned that the first time. I'm like, oh, the epiphysis is actually joined to the diaphysis in children. Now, our symphysis joints. Your pubic symphysis is the obvious one. You have fibrocartilage. Again, during childbirth, the iliums get to flare out, and this opening becomes even bigger. And our intervertebral discs. These are not movable. These can move. So again, we have a bad boy here. So symphysis joint, can you tell which one I like better? They are slightly movable with a pad of fibrocartilage in them. It's between our two vertebrae and between the two pubic bones. You need to know where it is, vertebrae and pubic bones, type of cartilage, fibro. And you need to know slightly movable. Our synchondrosis, that is immovable. You need to know it's immovable. You need to know it is hyaline cartilage. And you need to know it's between the ribs and sternum. Between the costal cartilage in the sternum, the costal cartilage in the ribs, and the epiphyseal plate as well. So, those are our immovable joints and our slightly movable joints. We will proceed. We will continue in our next lecture. Thank you.